either of them.
Okay, Chair, we are now live.
Are we not doing, we don't stream?
Lamont, you're muted. I don't know if you're.
I think he's trying to make it happen.
He also has Anna Vivian's for some reason an attendee, so I don't know if he wants to promote her
Oh,
to
yeah.
panelist also.
I thought I saw something when I logged in about it being live. I'm not sure, Lamont, if you have something that displays that on your end. But I thought when I logged in, there was something that said live.
Well, it would show that we're streaming on YouTube
Oh,
in the top of
okay.
the panel. If it's
I
fine,
think-
there's
I think under more, like on the bottom, there's like those three dots. Lamond might be able to click on that, and there might be an option to then select live on YouTube.
Quick question, how are people able to watch on YouTube? I should know this, given I'm a city resident,
go
but
to the city's YouTube page, and then you can find the different.
All right, here we go. We're going live on YouTube as we speak.
There we
There-
go.
Got it.
Now
There
we're
it
There's
is.
the live
doing-
stream, the
We're doing
webinar.
it all. We're doing it all tonight. All right.
And Lamond, Anna Vivian is in the attendees. If you could promote her.
Could you?
I definitely will.
Thank you so
Awesome.
much. There. All right. Well, I am going to call to order the June 15th meeting of the Community Services Committee. With us from the committee right now are myself, David Huvelman, Councilperson Barbara Smith, and Councilperson Brian Meek. We do not have a quorum at this moment, but we will begin the meeting and move through it. When we get to the action items, we will accordingly make our decisions as to what we do moving forward. So let's move to public comments. Is there anyone in the waiting room who wishes to address the committee? And I don't see anyone on the attendee list. So is there any member of the committee who has any correspondence that needs to be read into the record or anything that needs to be spoken about at this point? I see someone just joined. Anne Marie, if you are, we're in the public comment section of the meeting. If you wish to speak, please raise your hand electronically. And we have a hand raised. So,
Thank you.
if you
I
unmute
heard.
yourself, go ahead. If you'd like to speak, you have 3 minutes. Please go ahead.
No, I wanted to introduce myself. I am a graduate student, so I'm not sure how to mute myself. I just wanted to follow the meeting.
Oh, okay. Lamont, can you send back? That would be great.
Take care of that.
And I think we don't have anyone else who wishes to speak.
No, sir.
So we will close public comment and move on. We cannot approve the minutes of the meeting held on May 18th, 2023, because we do not have a quorum. Therefore, we will move that item to the next meeting of the Community Services Committee. Moving to the discussion section, number 4, updates from the Health Department. Ms. Diamore.
Good evening, Chair Huvelman and the committee. So tonight, the Health Department, we wanted to focus our updates on air quality and the poor air quality that we experienced last week in our region. Wanted to give a brief overview of the work that we did, and then also pass it on to Brian to show you a really great webpage that he's been working on. So as you know, the mayor, in partnership with Norwalk Public Schools and the health department, issued health advisories last week due to the poor air quality, sent out alerts to the media, updated social media frequently, also issued a code red message. We've made some updates to the city website and the health department website with additional language. Michelle DeLuca has also been updating her pages as well. We worked closely with Rec and Parks Department, DPW as well, on our response. We sent also, thanks to Lamont and Jasmine, sent out communications out to our community partners and presented on Lamont's community provider call. And we also made sure that we incorporated messages from the state health department as well as DEEP. So as I was meeting and speaking with the mayor and others, I mentioned, we have Brian Weeks now. We have an amazing epidemiologist, and, we should be thinking forward and how we can be getting this data and this information in one place moving forward, as we continue to address climate, health issues. And so I spoke to Brian, and in the meantime, he was already working on exactly what I wanted him to work on. So I really want to thank him for being really proactive about that. So I'm going to pass it on to him so he can give you a preview of what we're going to be launching and releasing to the public. We thought it'd be a great opportunity at this committee to give that update. So I'm going to pass it on to Brian.
All right. Yeah. Thank you, Deanna. Thank you, Chief Daniels. Thank you, everybody. So let me just jump into it, make sure I'm going to the correct tab I have, because I have a million tabs. All right, so I'll start off with the Air Quality Monitor Hub. So this is what Deanna has been referring to. And again, this is a preview. This is going to be released very soon. But nonetheless, you guys are getting like a sneak peek. And so with that said, this is the Air Quality Monitor Hub for the city of Norwalk, Connecticut. The big points to hit home is the following Norwalk Air Quality Monitor Hub webpage compiles up-to-date information, guidance, and resources to inform and empower our Norwalk community. And it's important, as we all know, that air quality impacts our health, as we've noticed with especially with the wildfires from Canada as of late. So with that said, and you scroll down the page, it goes straight into the Norwalk Air Quality Index situation. And so it goes into the current situation on the left-hand side here, that dial that you may have become familiar with coming from AirNow, which is designed by the EPA and managed by the EPA. And this is again for Norwalk. Keep in mind that our sensor location is in Westport, but it's a good indicator of what is going on in the city of Norwalk. And then as you can see here on the right-hand side is the flag system that the AirNow uses to kind of indicate, what's going on, as well as the forecast. And so on the right-hand side here is the forecast for ozone and PM 2.5. PM stands for particulate matter. It's a particularly concerning, particulate matter because it can get deeper in the respiratory system and sit in there, and it also can exacerbate any other respiratory conditions, and especially those that are asthmatic or something else of that nature, make their condition worse. So with that said, the forecast right now is that we would be in yellow, and that's more so again for later today, but then also with tomorrow. And so again, moderate, as you can see with the flag system here, is just one step above good. And with this website, as you can see here, one can obviously just learn more about this in terms of the links and access and better understand what AQI stands for, Air Quality Index. Again, it's a system designed by the EPA. And here's a little bit more detail. And so this is a table, again, straight from AirNow, just kind of interpreting the indices and also the level of concern. And again, yellow is moderate. And then what is a description of that? So air quality is acceptable, however, there may be risk for some people. And then as you can see, as you go up into the higher gradients of the colors, so orange, red, purple, maroon, obviously the health concerns are much more concerning. It's much broader in terms of who it impacts. So again, orange is for unhealthy, for sensitive groups, red unhealthy, purple very unhealthy, maroon hazardous. And again, recommendations tied to it. And then with that, there's also some national maps that we can kind of look at just to see what's going on in terms of just the plumes themselves, because obviously it's not just Connecticut that would be affected. And you can see kind of, that activity with the color coding, as mentioned before, throughout the nation, even parts of Canada. So you can get to see where it's starting off at and making its way to the rest of the country. And so again, it gives a good perspective of the current air quality situation as well as the air quality forecast, so we can kind of be in the know of what's going on and anticipate what's going to be happening. And as you can see here with the air quality forecast, that plume that's currently here in this left-hand side image is then suggestive that later on, as the winds kind of push it, it moves towards the east, which will potentially impact us to some degree. And that's why that forecast indicates moderate, activity with tomorrow. So that's something to keep in mind and be prepared for. But again, the winds change in terms of just how things play out. It can vary, right? Winds blowing all over the place is not the easiest thing to forecast too. So we have to kind of contend with that. But at the same time, it's good to stay in the know. So you can have this website as a great opportunity to check in, or as well, Air now has mobile phone apps. And so this is just a great way to get connected to them for, the iOS or for Android. And one can download this and it keeps you in the loop. It gives you alerts, shows the smoke plume and tracking it, as well as any other kind of guidance that they have. And again, right here is just showing air quality and health, and obviously the very interlinked nature of it, and especially as we were looking at those more severe levels, the more impact it will have on one's health if they're inhaling it. And so therefore, there's guidance, right? And so this guidance is pulled straight from Air Now, again, from the EPA. And this is what one could do to protect their health when air quality becomes poor, and what you could do to reduce your exposure outdoors and indoors. And again, very briefly, just to cover it, again, check the air quality, stay in the know. You can, and we'll also look at the alert system that one can sign up for, using an air purifier, keeping your windows and exterior doors closed when air is poor outside, air quality is poor outside. Obviously staying indoors, in a space that, can control the air quality itself is going to be helpful. Wearing a face mask as appropriate relative to, the activity levels, and relative to your health condition and vulnerability and sensitivity to the impact from the particulate matter and the other contaminants inside the air. Again, the portable air cleaner, running your HVAC system, which also has filtration, but making sure it has an appropriate filter that can help filter. Rescheduling any sort of outdoor activities, again, that's commensurate with, the activity level. So that would be presumably at orange or higher. That's where, somebody may recommend doing those actions. But again, it's up to everybody's individual and the organizational kind of recommendations based upon how they want to treat and triage the situation. So again, this is putting all this information in a standardized format in one web page for everybody's use and ability to get it in very quickly. And so again, there's a quick reminder, call 911 if you have any difficulty breathing or other kind of respiratory symptoms related to unsafe air quality. Don't delay that. And then here's the alerts that I was talking about. And so there's 3 here that are being, made available that you can find on the city website, but just kind of putting them all here. So number 1's Code Red, which is all the emergency alerts that, any Norwalkers should definitely be signed up for. Along with that is also the City of Norwalk Notify Me notifications. So again, that does include some emergency notifications along with, committee meetings and other things of interest that Norwalk residents may be interested in. And number 3 on the right here is the EnviroFlash Air Now notification system. It's actually really awesome. I recommend checking it out, clicking the links, signing up for it, and it will let you know based upon what threshold you set. So say if you set it for orange or for red, once the air quality is forecasted or currently at that status, it will send you a text message or it sends you an email to let you know. And so you could stay in the know and triage accordingly, because it's going to be important because these wildfires are still kind of running rampant. And so it's going to be an ongoing issue for some time. And with that said, special thanks to all the resources that have helped contribute to make this possible. And then finally, just social media link outs to the city webpage, where obviously we'll be making you aware of obviously very concerning situations, the health department as well, and then also Air Now. So you're definitely in the know from all the resources that exist locally and also nationally to get all that information that you need at your fingertips right away and stay in the know. So again, this is all just an opportunity to standardize this, get it compiled in one place, and really inform specifically a Norwalk resident or anybody interacting in the city of Norwalk to take the appropriate action and to protect your health in terms of air quality. So that is that page. So with that said, I'm now going to move quickly through what we usually get with the updates for the respiratory illness. I'm just going to fly through it because we're obviously in a good situation. So switching gears, this is for COVID-19. This is the new hospital admissions in the U.S. by county for the last 7 days. And as you can see, the country in general is in a very good place. We're still in the green. We're less than the 10 per 100,000 in terms of the new hospital admission rate. There's obviously still those exceptions in terms of certain counties in the Midwest or the South. Or the Southwest here, especially in Nevada. But overall, again, kind of the same situation with the subvariants of Omicron. XBB.1.5 is still the majority, but it is decreasing. It's almost at 40%. Now you got XBB, 116, 191, 161, 192, 2.3, and they're growing proportion, it's respectively. And as you can see, regionally speaking, as you can see with these subvariants, especially for region 1 and 2, which are better representations of what's going on here in the city of Norwalk, you can see how it's grown even beyond, the 1/3 we saw some time ago, the 1/2 that was recently, it's almost at like 2/3 now. And so it's just really amazing how, how quickly this has kind of just grown in terms of proportion, but it's kind of what we anticipated as a new subvariant outcompetes, the existing ones. And in this case, XBB.1.5 being outcompeted by the others. And then with that, still, even with that transition, the forecasting models, nationally speaking, are still holding steady. So that's very good news. At least, there's nothing, no bumps in there really noticeably. But, looking at it for the state of Connecticut, you can see it jumps around a little bit more jagged of a flat line there, but still more or less indicating a steady hold. So that's good news to see as well with those forecasting models for Connecticut. And then looking at it from national perspective for the big three, again, COVID, influenza, RSV, overall nationally for weekly emergency department visits, again, pretty much holding very low and close to baseline. So all good news. And with that, switching gears now, I just want to quickly and briefly go over Mpox, what we formerly know as monkeypox. Just keep in mind that it is Pride Month, and so there is, some concern and risk there in terms of just the potential for opportunity to transmit, given the, especially the high risk relative to men who have sex with men, given that the prior outbreak from last year with Mpox was about 90% relative to that criteria. So it's very important to keep in mind. We have to kind of be realistic about it. And right now with these updates from the CDC, as you can see, even for the year 2023, sporadically we are having cases, clusters of it that are detected. So it's important that obviously somebody suspects that they're exposed, following up accordingly with their healthcare provider, taking the proper prevention and precautions to protect oneself. And one of the big points at home is that there's a vaccine, the Jynneos vaccine, that cross protects against Mpox, and especially the severity of outcomes. So it's really, really important that anybody that may be eligible or feels like they would benefit from this, that they follow up. And there's a really great locator I mentioned before that, on the CDC webpage that one could use to find a local site or clinic that they feel would be a great place for them to get vaccinated. Keep in mind, again, it's a 2-dose series, so making sure you get those 2 doses, but it will help protect. And so that's really important as we kind of combat this and ensure we don't have a similar situation like we had last year with the outbreak kind of growing very exponentially, very high. But fortunately, it's sporadic right now in terms of the country, but we want to keep it that way. We still have, much of the summer to get through, and, this is, again, a great opportunity for transition, so we want to mitigate that. And then finally, just as a reminder, so the Connecticut Agricultural Experiment Station has set up their sites to continue mosquito trapping. That includes, the 2 sites that are in Norwalk. So far, no indication of any specimens trapped yet, and statewide speaking, no indication any EEE, no West Nile virus or any other kind of virus at the moment with the specimens that have been collected. So good news there, but that also means, we are in the midst of mosquito season, the very early parts of it, and it has the potential, as we move further into, say the summertime, to have some risk of exposure there. So again, taking those proper prevention measures and precautions. And again, that means using an insect repellent that's the EPA approved. And again, there's a list here, great one from the CDC. Again, just protecting yourself in terms of certain hours that obviously mosquitoes are going to be more active, wearing appropriate clothing too, to mitigate the opportunity for them to bite. And just, other kind of control measures one could do, in terms of like using mosquito nets if you're outdoors, if you're, sitting underneath an umbrella or something on your deck or whatever it is. Just, keeping that in mind because, we are in the midst of that. So with that said, that is kind of the overall update. I know a lot of things I threw at you. The big thing again is that air quality monitor for the city, and that should be unveiled very soon. But again, you guys got a nice little sneak peek here, and very happy to kind of, provide that opportunity to have a standardized mechanism for us to kind of stay in the know and be able to advise ourselves and others. All right, thank you very much.
Brian, thank you for that. And that air quality site looks fantastic. When is that going to launch? You said it was not quite up yet?
Yeah, so technically we have a web link available. We're looking to finalize a shortened web link. So we're working with the mayor's office. This was all in conjunction with the mayor's office as well as with IT. So we're just getting that finalized, hopefully in the next day. But again, there is some variables that are playing into that, but very soon it's going to be coming out.
Okay, great. Well, thank you very much. And Deanna, thank you as well. I just, before we go forward, I want to call to note that Ms. Ayers, Councilperson Ayers joined us at 7:19 p.m. and Councilperson Diana Revolus joined us at 7:23 p.m. to let the record show. Does anyone have any questions for Deanna or for Brian? Seeing none, we will move forward. Actually, I'm going to move back now that we do have a quorum. I would like to go back to item 3, approval of the minutes from the meeting held on May 18th, 2023. Can I have a motion?
Motion.
Thank you, Councilperson Revolus. Are there any changes, emendations, omissions, corrections? Seeing and hearing none, I will call for the vote. All in favor of approving the minutes from the meeting of May 18th, please signify by raising your hand.
Aye.
Abstain.
Let the record show, I'm sorry, any no and any
Sorry.
abstentions? I'm sorry, Ms. Ayers, was that a no or an abstention?
I voted for it.
Oh, for it. Okay, thank you. So we had 1 abstention and 1, 2, 3, 4 yay votes. So the meeting minutes from May 18th are accepted into the record. Moving back to item 4, discussion, we now have B, Mid-Fairfield's Latinx Integrated Care or LINK program presentation. I'll turn this over to Chief Lamont Daniels, who I think is going to introduce some guests and move this forward.
I am. Thank you very much, Chair Hulaman, and good evening, everyone. Good evening, Council. Good evening, Norwalk. Let me first say that 3 years ago, under the former superintendent, when our city received a quite enormous or alarming number of children or students that came into the Norwalk Public School system, and I actually was here at that time. And I remember when teachers in the administration was really concerned about their well-being. We have to remember that the children that came here often have arrived in our country based on horrendous circumstances, and our colleagues, they were able to speak further. And I was instructed and directed in my newly formed department, it'll be 4 years here in November, to oversee this program when it was approved by Common Council 3 years ago. And so moving forward, I have asked Gail, Clara, and Marissa to not only just give an update as they normally would, as they do every year, because this is an annual program, to really, give specifically you, council leaders, a deeper dive in the number of children are coming and what they've experienced and why this program is still critical even 3 years later. And so they are prepared to do a presentation, and then I'll yield back to the chair, and then myself along with them will be open to answering any questions as council may have. So Council Chair Hulaman, through you, I would like to introduce the Mid-Fairfield team, and I'll let them introduce themselves. And I don't know who, I think as panelists, everybody can present the slide deck. I just don't know who actually has the actual slide deck.
I do.
Hey,
I'm going to
Marissa.
share.
Okay, great. So why don't you start by introducing yourself?
Sure. I'm actually gonna, I just want to get this up there because
Awesome.
can everyone
Yep.
see? Yep. Just want to make sure this goes, all righty. Greetings, everyone, Chair Hugelman and members of the Community Services Committee. Thank you first and foremost. I know we're going to get into a couple introductions, but just wanted to thank you all so incredibly much for the opportunity to present here this evening. The work and the support and the investment that you've provided Mid-Fairfield to ensure that these new arrivals have the wraparound clinical supports has been, and care coordination supports has been instrumental. So Gail, do you want to do a little brief introduction and then we'll introduce Clara?
Sure. So I am Gail Melanson. I'm the Executive Director of Mid-Fairfield. I've been with Mid-Fairfield for 26 years, and I've been the Executive Director for 3 or 4 years now. So again, I'll reiterate with what Marissa said. Thank you very much for the opportunity to present the amazing work that my staff are doing to support these children and their families. And I'll turn it to Clara.
Good evening, everyone. My name is Clara Mesa, and I am the Director of Community-Based Services at Mid-Fairfield. I joined Mid-Fairfield back in 2020, originally back in 2015, left for a short period of time, and then came right back. And I've had the pleasure since returning to help launch and develop this program that I will tell you more about. It is near and dear to my heart, so I am very excited to be here and to share a little bit more about what it is we are doing.
And I know I introduced myself, but Lamont knows this, and everyone who knows me knows this. I always start, I'm first and foremost a proud parent of Norwalk Public School students, a lifelong Norwalk resident, live here with my family as well. So I'll just, most of you know, but Mid-Fairfield is a nonprofit, one of the largest outpatient behavioral health clinics in the community. And we ensure that all children, regardless of their financial circumstances and or language barriers, have access to equitable mental and behavioral health services, as well as additional wraparound supports. As Lamont mentioned, we are here this evening to present on our Latinx Integrated Care Program, and I am going to turn it over to Clara. Assuming everyone can see the slides as I'm going?
Yes,
Yeah.
you're good.
Okay, cool. I'm going to mute myself, Clara, while you talk.
Sounds good. Since 2019, 1,354 immigrant children from Latin American countries have entered Norwalk Public Schools. When LINK first launched, most of our students being referred were arriving from what's commonly referred to as the Northern Triangle, Honduras, Guatemala, and El Salvador. In the last year or so, we've noticed a shift, and many of our clients are also coming from South American countries like Ecuador, Peru, Venezuela, and Colombia. As you can see on this graph, year after year, immigrant children are arriving and enrolling in our public school system. Ensuring that these students and their families are healthy, protected, and able to contribute to our community is not only the focus of LINK, but also benefits our society at large.
Sorry, going back and forth from mute to unmute. So our response and the community's response, this slide really gives just a highlight of some key milestones in the program development over the last few years. As Lamont mentioned, in September, October of 2019, Norwalk Public Schools and the community saw an influx of Spanish-speaking immigrant students. And in November of that year, the mayor, along with the Common Council, appropriated $1.4 million in funding to support the educational and wraparound needs of these students. And Mid-Fairfield was allocated about $400,000 to really specifically work on that clinical work, as well as that care coordination work. I see a hand raised.
No, I'll wait till after. I'm just coming first in line, but I'll wait till after.
Oh,
Go ahead.
okay.
Yeah, just keep, I'm sorry, Marissa, you can keep forward.
Oh, okay, no worries. In February 2020, the program officially launched as the L School-Based Initiative, again, which delivers confidential, trauma-focused, and culturally responsive school, home, and clinic-based mental health services for these new arrivals. Clara Mesa, who you met, was hired as our program director. And at the time, we conducted a thorough needs assessment in partnership with the schools to determine the schools with the highest needs based off of these assessments conducted by the individual schools. One thing we want to just really point out is that in June 2021, we decided to change the name to the Latinx Integrated Care Program, LINK, from the L School-Based Initiative to better represent the population. And really, as we're looking to create a link and bridge between the students and the families in our school community. This past year, we were awarded a funding from private philanthropy to expand to a third team. Given the numbers that you saw on the previous slide, the need continues to be great. And so through this investment, we were able to help more children and families in the community. And our team is currently looking at additional ways to implement some evidence-based interventions specifically for the immigrant and refugee youth within our school system. So we are exploring those options, and I know Clara is going to speak to that as we get further along in the slide.
Some important distinctions. When we talk about the Latinx or Latina population, we're talking about a broad group of people. So I want to take a moment to go through a refresher of some terminology that applies to our LINC population in particular. By no means is this an exhaustive list. Immigrant. This is a broad category that encapsulates foreign-born non-citizens who leave their country to settle in another country. Newcomer. This is a student who has entered a school as a new member of the community, typically after arrival from a new country. And we often use the term recent arrival within our LINC program as well. Unaccompanied minor. This is a child who is under the age of 18 who has no lawful immigration status in the US and enters without a parent or legal guardian here to provide care and physical custody for them. A refugee is an individual who flees one's country due to restriction or danger to their lives and is unable or unwilling to return because of a well-founded fear of being persecuted because of their race, religion, nationality, membership to a particular social group, or political opinion. An asylum seeker is someone who seeks international protection from dangers in their home country, but whose claim for refugee status has not been determined legally. And undocumented. These are foreign nationals residing in the US without legal immigration status. As we go through the rest of this presentation, I ask that you keep these terms in mind and remember that the Latinx immigrant population is not homogeneous, and in fact, it's incredibly complex. So migration trauma. When we look at drivers of migration, we can look at things like push and pull factors. Push factors are things like lack of opportunity, lack of access to education, corrupt governments, and lack of access to medical care. Pull factors can include things like opportunity, higher standard of living, jobs, fair and just governments, and access to medical care. The families enrolled in our LINC program face multiple traumas pre-migration, during migration, and during resettlement. Some of the pre-flight traumas can include those push and pull factors I just mentioned, in addition to things like persecution, forced labor, and torture. During migration or their flight, stressors and trauma include things like separation from family members, direct or witnessed violence, coercion, and hazardous travel. Then, once they arrive, they are met with post-migration or resettlement stressors and traumas, including acculturation, isolation and discrimination, and survivor's guilt, among many others. All of these stressors considerably increase the risk for mental health problems. The research shows that despite higher mental health needs, young immigrants and refugees are less likely to receive treatment services in comparison to their non-immigrant peers. Because of your continued investment in our LINC program, our most vulnerable students and their caregivers are able to access culturally sensitive and linguistically appropriate services that can help them navigate these daily stressors and ultimately heal. Our service delivery model has been designed to deliver unique and differentiated supports for students with a focus on equity. Our teams consist of licensed clinicians and care coordinators, all of whom are bicultural and Spanish speaking. Length of clinical services are expected to average 12 to 18 months, while care coordination services average between 6 and 12 months. This all depends, of course, on the individual needs of the client and the family. With our model, we offer flexibility to meet families where they are. It's thanks to our partnership with Norwalk Public Schools that we've been able to enter the schools and offer services during the school day so that we can reduce barriers to care and also collaborate very closely with school personnel. We're also able to offer home visits, which allows us to better engage the family system. Given the psychosocial stressors that are present within this population, it's an essential component that we're able to offer families appointment times outside of the traditional school day, which is often a limitation to caregiver engagement and really sets us apart from other supports. As stated by one of our partners at the high school, quote, giving students who suffer with anxiety, depression, and low self-esteem the chance to work with bilingual care coordinators and clinicians is critical to their ability to begin healing from their trauma while adapting to a completely new environment. Students in the LINK program have shown improvement not only academically, but in their overall well-being. I have watched my students gain confidence, self-advocate, and become hopeful for their futures. The LINK program gives them the chance to live healthy, fulfilling lives, end quote. Oftentimes, our program is the very first time families interact with our mental health system. Because of this, it's critical that our staff utilize a trauma-informed and culturally sensitive approach to help build trusting relationships. We have a unique focus on the engagement period and the connections we build with families because trusted providers have been shown to build things like familiarity, tighter connections, and trust with other providers that then reassure families that the best interest of their children is truly at the center of care. Through our clinical services, we target symptoms such as anxiety, depression, trauma, disrupted attachment, and acculturative stress. We encourage caregivers to be a part of our treatment, particularly in the case of families that are reunifying after many years apart or unaccompanied minors whose sponsor is an extended family member they may not know well. We have many cases where students and caregivers have been separated for more than 5 years and now are met with the challenges of resettlement in addition to navigating new roles, new rules on top of our daily stressors. Our care coordinators use the wraparound process to identify underlying needs from the family's perspective. They work alongside the entire family to build a team of supports to help them get closer towards their family goals. In addition to connecting families to community resources, they also serve as a bridge between the schools and caregivers, teaching families how to reach out to schools, make Power School accounts, track their students' grades and attendance, all despite language and cultural barriers. Care coordinators have also helped families with things like navigating public transportation, utilizing the post office, enrolling students in extracurricular activities, and applying to college, just to name a few. Care coordinators strive to teach families how to do things independently so that when our services are no longer involved, families feel more competent and connected to the Norwalk community. This work is critical, and we are fortunate that the city has entrusted us to be able to provide this specialized population with specialized treatment. Focusing on this current fiscal year, we've served 108 families. Of those 108, 67 have received clinical services and 41 have received care coordination services. I do want to highlight that because care coordination services often include the whole family, we often service more than one Norwalk Public Schools student at a time. On the right-hand side, you'll see a breakdown of gender and ages of the students we've served this fiscal year. Since launching the program in 2020, we've received a total of 166 referrals for students enrolled at our partner schools. We've been able to provide over 100 families with clinical services and over 90 families with care coordination services. As you've heard us mention throughout this presentation, the LINK population is complex and multi-layered. The graphs on this slide give you a snapshot of the number of traumatic exposures and basic needs, such as access to food, housing, and medical attention that these students and their families have. It should be noted that on average, students enrolled in our services report at least 4 basic needs and at least 5 different trauma exposures at intake. And this isn't taking into account that families often underreport their trauma exposures at our intake. It's due to the vulnerabilities of this population that we're constantly assessing the needs of our family and in turn tailoring our programmatic implementation to meet their diverse needs. So let's take a look at some of our impact. We asked Link families what they've learned about themselves and their families through our services. And here are a couple of comments that they shared. From a parent of a middle school student, quote, Link is a family support program. They teach us to know our kids better and to see within them. They provided us with emotional support. As a team, we develop strategies to help and support our children. They also teach us to find resources in the community like health services and food, end quote. Another parent of an elementary school student shared, quote, they've helped me to have a better relationship with my daughter. I learned that Link helps families that have just arrived in the country. I have learned that in life, there are people who help you and support you without expecting anything in return, end quote. So let's take a look at how this translates into our service metrics. On the left-hand side, you can see that in the last fiscal year, we've had between an 80 and 100% rate of kept appointments. Our program satisfaction data on the right indicates that families enrolled in our services feel that their cultural and ethnic background are both respected and understood. Families also report feeling more equipped to handle crises after engaging in our services, as well as building a support network that extends beyond us as providers, which again speaks to that self-sufficiency I highlighted before. More than 50% of families meet their treatment goals at discharge, in addition to demonstrating at least a 5-point decrease in problem severity and or a 5-point increase in overall functioning on our Ohio scales. 90% of families that discharged from care coordination demonstrated at least a 1-point decrease in number of basic needs pre to post services. One of our high school clients said to our team at discharge, quote, honestly, I felt extremely overwhelmed before I met Link, and now I'm emotionally stable.
Thank you so much, Clara. One of the things that we did just want to briefly touch upon is our implementation framework and what that looks like. Your investment helps to fund Clara, our licensed master's level clinician. Link is supervised for her. She provides weekly supervision, staff, and biweekly team meetings. We have collaborative meetings with participating school administrators, support staff, where she reviews referrals, active caseloads, processes, and procedures to ensure a streamlined approach to care. Triaging referrals. Clara is constantly in the team are triaging referrals that come in to ensure that those in need are seen immediately, and if additional supports within the community are needed, referred to those as well. Working with Lamond, we provide program data monthly to him and his team, just to ensure that we are providing those metrics and outcomes that Clara alluded to before. Community collaboration, regular meetings with NPS, Lamond, as I alluded to, and other community and school-based providers. In addition, the funding goes to support 2 teams, each staffed by a licensed master level clinician and a certified bachelor's level care coordinator. All are bilingual and bicultural. The clinician, as Clara alluded to, provides school, clinic, and or home-based weekly trauma-focused and evidence-informed individual family therapies, parent psychoeducation, and crisis management. And the average number of students a clinician has at any point in time is between 18 and 20. The care coordinator, again, we have 2 that are trained in the wraparound model, provide school, clinic, and home-based weekly visits with the student and the family to build a network of supports. An average number of students a care coordinator is helping at any point in time is between 12 and 14. And I know Clara alluded to before the length of stay for a student engaged in either care coordination and or clinical services. So in terms of next steps with Link, we are continuing to explore ongoing partnerships with community providers, not just in Norwalk, but with others that are interested in learning more about replicating this work in their own communities. And so it's really exciting for us and the city and the district to be a model for other communities throughout Connecticut. Again, we're constantly looking at data through our partnership with Norwalk Public Schools and Norwalk ACTS We have a dashboard where we're able to monitor key academic indicators, including school attendance, disciplinary incidences, and educational assessments to really measure the impact of our programs and services. I will let Clara kind of talk briefly about the last 2 bullet points.
Thanks, Marissa. One of the other things we'd like to do is to continue exploring culturally sensitive measurement tools that really demonstrate impact for factors such as peer relationships, resilience, and connectedness. The other thing that Marissa alluded to earlier in the presentation is exploring the implementation of STRONG. STRONG stands for Supporting Transition Resilience of Newcomer Groups. It's a manualized program focused on building skills and helping students process their migration journey. Strong content and structure was informed by other school-based interventions like CBITS and Bounce Back, which other clinicians at our agency have been trained in.
Okay, thank you
And that-
very much.
there you go.
From our colleagues at Ms. Fairfield. So at this point, I'll yield back to our chairperson and specific city questions. I'm happy to respond to, and then specific practice questions that Ms. Fairfield team will also be available to respond to as well. And also to remind everyone, this presentation is also connected to the action item of the continuation of funding this program. Thank you, Chair.
Thank you, Lamont. And Marissa, Gail, and Clara, thank you so much for the presentation. I just want to say that I was on the council in 2019 when this first came up. And I remember the discussions about how to appropriate this money to help with this particular emergent situation that we were facing. And the model that came up was not just all of the money going to the school system when Mid-Fairfield stepped in, and what you guys were able to do, and we were able to then vote for that to move that money towards your model of system and what you've created since then from that emergent situation into something that's an ongoing program based on the success that we've seen. I was very proud to vote for it then, and I still think it's a very important program that under Lamond Community Services Department we brought into the city, and under the work that you guys have done. And I just wanted to say thank you for that work, and it is much appreciated. And again, like I said, I was proud to vote for it then. I'm proud to vote for it now. Ms. Revolus, you had your hand up through the whole thing, so I will let you take it away.
Thank you. So the reason why, obviously, you guys may know why I'm raising my hand here is because I come from a family that actually started these grassroots efforts first, which is from Stanford, which is new arrivals, so on. That being said, it actually merited helping children, in particular in Stanford, that came from all different types of walk of life, but directly started with the Haitian community. Why I'm saying that? One of the most depressing things for everything I've heard was part of the Latinx community that doesn't get responded to, not only in the Latin community, the English community, and even in the Black community. And that is the Haitian community. The Latino, Latina, Latinx is Latin-based derivative communities. French Creole is a Latin-based derivative, sorry. The island of Haiti is part of the Spanish, the Latin America, right? So that being said, everything you said, we have responded to with the Spanish community, with Ukraine, with Afghanistan, but Haiti is going through this right now. I'm getting calls left and right. Stanford actually knows that their largest Latino community is the Haitian community. So that being said, I love this, but I need to hear where part of this community is being represented and helps here, because we're not separate from what you're doing just because we speak French and you speak Spanish. We're Latino as well. So that being said, for particularly my vote, and in particularly in the connections with the school system, I would love to see how that narrative and how people are in your organization directly relating to the Haitian community who is dealing with all the anxiety, depressions, turmoil, and tribulations right now. and what's coming through when you guys started and was here well into like the 80s, 70s and before, because I'm second generation and my parents doing it. So why I'm asking this, especially with government turmoil, people losing their lives, children coming here without adults, women coming here pregnant. How are we responding to one of our brethren, the Haitian community, through this?
Let me jump in specifically, and Councilwoman, I really do understand what you're saying and the need to address the needs of all populations. But I
The
do
only
need
reason
to,
I bring it, not to cut it out, but the only reason I bring it up is because I grew up in it being started in one, but I ended up, but the Haitian Community Center helped Hispanics, helped from Ukraine, everywhere. Like I got calls from everywhere my father passed, right? So I'm just seeing where, especially in these spaces, does it open the narration, right? So that's why I'm bringing it up. Even if it's not here, it should be, but just wondering where. And I'm not going to minimize what you have moved and done in Norwalk, Lamont. That's why I'm just going to say that when
I
you jump in.
understand
I
that.
don't want to minimize that at all. Just bringing it up because I'm here, I'm
No,
Haitian.
You bring extreme valid points, and I know that when we have these discussions, and we talked about it even on our Norwalk calls around, there was another program that specifically targeted our diversion youth, and then there's the baby bonds. It was like, oh wow, I wish when I was born there was the baby bond program. But I to Chair Huberman's point is, this program was specifically identified actually by the district, not the city. And they advocated strongly that they needed help when the influx of the children entered our city. And they identified and advocated strongly around, if the city was to help, this is what this would look like. So I just want to be clear that on the city side, especially in my role, this was under the former administration at the superintendent's office, and they identified a need. I think the other piece is, as it was pointed out in the PowerPoint slide deck, that it was 1.4, and when I advocate, or we advocate on the city side, is that we would administer that particular program so that this will allow the flexibility so that this program can also do home visits, because we know if it was to be embedded in the school, there was a lot of complications through home visits. And I've said this before, and I also say this publicly, my office is eager to meet with every group so we can better understand what those needs are and begin to think about what resources, tools, and strategies that we can support all of our residents, because that's what we're here for. We support the well-being and quality of life for all of our residents. So I just wanted to underscore how this program 3 years ago was identified, and that the Ms. Fairfield is the contractee, I get contractor and contractee mixed up to administer this particular program. And Gail, I don't know if you all want to talk about other programs that you may do in addition to this specific program.
Absolutely.
Yeah, and that might answer my question, not to cut off, that might answer my question with the additionals, because again, and how we respond, and that's why I said what I said, the ignoring in a bit. 3 years ago, currently, 5 years ago, earthquake. So it has always been the Haitian community, and part of the Latino community is the Haitian community. So when you speak about Latino need, Haitians are directly a part of it. This is why I'm bringing that, because the ignoring or forgetting that's Latino, Latina, period. So when what I'm saying is we separate the two when we shouldn't. You know what I mean? So they're part of that group. If you got the explanation that we need the help, they're part of it. They're part of the percentage that we needed 3 years ago, because 3 years ago they were coming over through Venezuela. They were actually getting deported back from Venezuela, while people from Venezuela was coming in. So that being said,
can you
know what I
speak to
mean?
some of that?
Yeah, I mean, Gail, do you want to allude to? Okay, go ahead.
Sure. So I would just like to say that we are proud that we have several Haitian Creole speaking clinicians who provide clinical support for children of all ages in our outpatient clinic. And we also have a care coordinator, a Haitian Creole speaking care coordinator who also would work with a clinician. So if there was a family that needed support who speaks Haitian Creole, the care coordinator and the clinician would work together just like they do at Link. And the care coordinator would focus on the concrete needs and doing the same thing that the care coordinators do through Link, and the clinician would also provide family support and all of the same services.
Okay. Are you seeing an influx now, though, in particular? Because I'm getting a lot of calls. Is there a
Please
particular
send them
influx?
our way, because
Okay,
sometimes
I
I
sure
feel
will.
like our clinicians
Well-
our Haitian Creole clinicians have definitely, they get the
We'll talk
referrals. but-
offline then.
And,
We'll
and
talk
sure,
offline.
Th-
Thank
Diane,
you so much,
I-
guys. I appreciate you.
And I also wanted to just mention that one of our clinicians in the middle schools is also Haitian Creole speaking. So I wanted to mention that as well.
I appreciate you guys. Thank you for answering, and I'll
Thank
speak
you.
offline. I
Sure.
appreciate it. I
Great.
won't take any more time.
Thank you. Thank you.
Thank you, Councilperson Revelous. Councilperson Meek.
Feel free to say woman for me, councilwoman for me. Thanks.
Okay. You're on mute, Mr. Meek.
Thank you, Chair. And I want to thank Councilwoman Revelous for bringing up Haiti. I was thinking about that. But first off, I do want to say, I commend Mid-Fairfield. You're doing God's work. Don't be put off by my questions coming up here. I'm curious. I heard Chair Kovelman say this program was launched in 19. I'm curious about the language that says this is only available for public school children. Does this get charged back to the Norwalk Public School budget is my first question. And the second follow-up question within finance and legality is that an end run around the MBR number that we're beholden to by state law? These may be questions for legal and finance, weren't here, but if someone knows, I'd appreciate that. And then I just have a few questions after that.
Sure, Councilman Meek, I can answer the first one, and to your point, I think the second question definitely would probably be deferred to the MBR that you're referencing. No, this is a program that is funded through our department, and we do not get reimbursement from the district.
Okay, thanks. So the second part, though, or maybe the first part, and I confuse that. Because we're making this exclusive for public school children, how do we get around not providing this for private school children? Certainly there's migrant children at our local parochial schools and private schools that they're just not eligible for these services. I don't understand that.
So
Go ahead, Marissa.
And so clinically within the organization as a whole, we have the largest bicultural, bilingual Spanish-speaking clinical team in the area. And we have families, I don't know how many currently clinicians we have across the board, but we have families from private schools and other communities receiving, mental and behavioral health services, as well as care coordination, as well as victims of crime services, as well as our extended day treatment program, which provides comprehensive care after school for kids, and our intensive outpatient program. So the breadth of our services and our programs, we have bilingual capacity and accept all children regardless of their ability to pay or their documentation status. I don't know if that answers your question.
Right, so
Well,
these particular.
The agenda says public school children. That implies to me that you have to be enrolled in public schools.
For this particular program, yes, sir.
For this specific program, yes. I was speaking globally to the agency as a whole in terms of capacity. We have capacity for anyone.
Right.
Right, and the staff members for Link are specifically embedded in the schools to provide support in the schools there. So if there are individuals in other schools, they can come to our outpatient clinic and also get care coordination and clinical support. And we always provide consultation. So if they're in a private school and need support for the teacher or the staff on how to help support that child, we provide that consultation as well.
Okay, I mean, I think you answered my question. It seems exclusionary to public school children, and I don't understand how that doesn't circumvent the intent of the MBR laws at the state level. We're basically paying for school services out of the city budget, but not counting it against the school budget. I'll take this up with finance and legal. I appreciate your responses. The last part I had.
Can I just add something there, Mr. Meek, I know it says school-based, but this particular model also provides home-based services as well to meet the needs of and clinic-based services, providing in those multiple settings. I just wanted to reiterate that.
I understand, that's great, but our agenda, the item that we are voting on says for public school children.
That is correct.
Thank you. Okay, the second part I had here, I was just, and I thank again, Councilwoman Revolus for raising it. She's clearly
thank you,
closer to
too.
this than me. I was thinking about the Haitian earthquake. And, through the presentation, we're hearing that this is not a homogeneous population. And then you end it with labeling them Latinx. And I don't understand why Latinx has anything to do with anything other than migrant children and families needing support. I wish we would really drop the labels. Thank you. That's all I have to say.
Thank you, Councilperson Meek. Councilperson Smith.
First of all, I'd just like to thank Mr. Meek and Ms. Revolus for their really important and compelling questions. I think, you both have brought up some things to think about, the exclusivity and, that Brian just mentioned. We're taking care of kids, who are in need. So just, some food for thought, I think. I have a couple comments and a couple questions. I was teaching at Norwalk High School that first year when the clinician was working right around the corner from my classroom. And, I saw some of these kids were in my classes, and the trauma was just, it was heartbreaking. It was really heartbreaking. And I saw the work that was being done, and I saw the kids over a period of months start to come out of their shells a little bit. So I think that the work that you're doing there is incredible. And potentially saving lives. These kids have been really, really traumatized. Are you finding that so that was the year, it was like we had that influx, right? And we were unprepared for it. So we had to address it. Are you finding that as time has gone by, the kids are still coming to us with as much trauma?
Sarah, you want to take that? I see you. I see your head nodding since you're on the ground.
I think the short answer is yes. I think the biggest difference that we've seen in terms of the population shifting in the referral source is that we're seeing the kids coming from a larger variety of Spanish-speaking countries. And so when we first launched, it was a lot from that Northern Triangle, primarily actually Honduras and Guatemala. So the types of traumas sometimes do have a theme with regards to the region that they're coming from, specifically within that country. So depending on where they're coming from in there are certain risk factors that they come with that are unique to that region, but the traumas don't necessarily vary very much from country to country because the experience, even though it is unique, has a lot of the same themes to it. And so we're seeing that the kids are being impacted just as much, even 3 years later. And particularly with the unaccompanied minors, the idea of coming to a new country and not really knowing who they're living with. It is a family member, but a family member that they haven't known in 10 plus years, and navigating those relationships become incredibly complex and impact their every aspect of their life.
Well, I know you're doing incredible work, and the kids are, getting the help that they need. So I think that that's really important. And I just want to clarify something. So these funds have already been approved in the operating budget, and we're approving the agreement.
That is correct.
Okay,
That is correct.
thank you.
Thank you, Councilperson Smith. Councilman Meek, your hand is still up, just to let you know. I'm not sure if you wanted to speak again, but we'll move on to Councilperson Nicole Ayers.
Thank you, Mr. Chairman. Let me just say in advance, I am at a convention, so it might be extremely loud behind me. So I do apologize. I'm like in a corner trying to be a part of the meeting, so I do apologize. I do want to say to the staff of Child Guidance, very much with what my colleague, Mr. Meek, said, I do think you're doing good work, and I do appreciate the work that you're doing for the little people, our children of the city and their families. And I want to say that. But I do have some questions. I don't know if it's concerns. I want to say I support your mission. I support the work you do, but there's some questions that are just sitting with me, and hopefully you'll be able to answer them. The first question is, per your presentation, when you were initially given the money in 2019, was it your understanding at Child Guidance that this was just going to be renewed forever, or was there going to be an end date to this funding?
Councilwoman, I will just speak to that I don't recall having that conversation with Child Guidance.
Okay. Because you guys are just getting the money every year, and you did on one of your slides show the impact, but this is a substantial amount of money, and if my calculations are correct, we have been funding this particular program for 5 years. I don't know if it's strategically sound for Child Guidance to depend on receiving this money every year. Do you have any other strategic plans on how to supplement this money, if you can speak to that?
Yeah, I'm going to defer to them, because I think it's important, especially the way I lead the department, is that one model that often has really put us a step of other municipalities, I'll proudly say, is the ability for the city to help our local nonprofits leverage additional resources. And we've seen that with our family navigation program. As you all remember, for the past 3 years, it was privately funded first. And now the city will be contributing, but it was the private funding that really got the attention of the city. And this program is exactly similar in that, to your point, Councilwoman, the city, yes, it's correct. The city has made an investment of $400,000, but Mid-Fairfield, and I'll let them speak to this, I don't want to steal their thunder, but it's the way I lead in terms of how I use taxpayers' dollars, is that and they mentioned it, but it probably got lost in the presentation, that because of the city's investment, philanthropy and nonprofits saying, wow, if the city sees it's important, we're going to make additional investments, which is now, they point out, they have expanded to more teams because of the city's investment. This would not have happened if the city didn't make an investment. And that's a common practice that is often used throughout the country in terms of philanthropy want to see local government involved in these issues that are also important. So I'll defer to you all if you all want to add to it, but I know that that's what kept us kind of invested in this, because philanthropy said, hey, if the city's doing it, we're going to match the city's dollars so they can expand and expand services, so they continue doing their services. And then, before you all expand, I just want to say, going back to what Councilwoman Revelo said, I mean, this is an opportunity to relook at their contract. We're up for a contract. And so I just want to say that I am taking very seriously your comments and your suggestions. and my team, Anna Vivian and I will definitely be working with Marissa, Gail, and Clara, so we can look at the contract, and there's always room for improvement, and I'll be first to say that. So I just want to know that that was heard. So folks, I know you have talked about and you are presented across the region of having municipality involved and what that has done. So can you all just share very briefly how that has impacted and built the sustainability moving forward because of the city's initial investment for this program? Anyone can take it.
Lamont, you go ahead, Gail, or.
But
You
I
want
guess
me
you
to
can just hear what the philanthropy has
Sure,
said to you
yeah.
and why they're doing this.
Absolutely. And this has happened with many initiatives that we have had that we have secured private philanthropy to provide services in the school district. For example, we provide trauma-informed care training to all staff in all of the schools, and we provide trauma treatment. And this is completely funded by private philanthropy. And we've been had that grant renewed for how many years now? 4 or 5 years, Marissa. So, and as Lamont said, for this, we were able to secure additional funding that allows us to hire another clinician and a coordinator. And I know you hear, the dollar amount, it seems like it's a lot of money, but when you're looking at the salaries to pay multicultural, bilingual staff, the training, the support, the Clara is, we like to say she's a unicorn. She's a LCSW, she's bilingual. So she isn't just a supervisor supervising her team. She also speaks the language, she communicates, she has the ability to communicate with families, and she has the expertise at the highest level to, as it was talked about, to triage these cases. So it takes a lot of expertise, and Clara has done an amazing job. And as you mentioned, we did get this funding initially, but then Clara was able to form a comprehensive program that can be sustained based on how we're serving it, how we're serving the students, and how we're collaborating with the school and the district to make sure that it is a success. So as much as it seems like we're just carrying on, it's actually been growing and developing into a solid program. And Marissa is amazing at always securing private philanthropy, fundraising. We do a lot of things because, and Marissa can talk to this, the money we receive from grants is only a small portion of what we can use to pay for all of the services that we have to provide.
So are you saying that if you did not have the city's portion of what you have collected for this particular initiative, understanding that Child Guidance has several different programmings, that the programming would not be able to continue? Is that what you're saying?
It would be, we would not be able to sustain it at the level it is right now. We have private philanthropy for a team. We potentially do fundraising to add to the contributions of grants and city and NPS dollars, but it's through the combination of all of it. So we would definitely not be able to sustain it at the level it is now without the city's investment, but we have been able to grow and expand and hope to continue to grow and expand. And as Lamont mentioned, perhaps look at other models or look at the contract to see how we can support additional individuals.
Okay. I have a couple of more questions if you do not
Sure,
mind.
absolutely.
I think that, is there any matrix or a pulse on, and this might be above you, because you're addressing what is being brought to you. You don't have control of the influx of the young people coming into the town. But do you see this kind of dwindling down, or is this going to continue to grow year after year? Because it's very hard. I have a nonprofit background, so I know how to raise money. I know how to move money. I know what this is. It's very hard to be dependent, or it's not a good business practice. Let me put it that way. It's not a good business practice to be solely dependent or majorly dependent on any source, because no source is guaranteed. And so what I don't hear, I hear you're saying, we're supplementing, we're getting this, but it's only because the city has made this initial investment. But if the investment dries up, you're still saying we're gonna have all these children without services. So strategically, what is Child Guidance's plan? And you might not have one. You might be saying, Nicole, thank you, we need to put that down. What is the plan for when the money is not going to be there? Because I haven't heard in your presentation, and maybe I missed it, and if I did, I do apologize. What's
So-
gonna happen in the next 5 years with this?
Yep. So we are constantly looking forward in terms of sustainability of our total operating budget. We have a percentage that comes from insurance, Medicaid fees, right? We have a percentage that comes from private philanthropy, and we have a percentage that comes from grants, whether that be public funding through the Department of Children and Families, through federal funding, and then obviously through our ongoing partnership with the city. So Nicole, I couldn't agree with you more in terms of having nonprofits rely on one sole source of income. It's not practice, and it's just, so we don't at Mid-Fairfield, and I'm happy to share with you a overall percentage of where the funding comes from for the agency as a whole, and in terms of our programs. We are constantly, as Gail alluded to, looking at how to grow and diversifying our funding portfolio. And as she alluded to before, this investment allowed us to further expand to a third team. And we are looking holistically, again, at how to sustain all of our programs. The need, and I know I'm maybe going off tangent here, the mental health crisis among all children, all communities, is so significant and so staggering. And treatment lies on a continuum, just like physical health lies on a continuum, mental health lies on a continuum. So the more complex a child's mental health needs are based off of, their symptomology or their trauma factors, the more complex the treatment is and the more it costs, right? So looking at it as a continuum, that's what we do at Mid-Fairfield in terms of all of our programs. We do have a plan in place. We are constantly looking at ways to sustain our programs and our work, and we're constantly meeting with private philanthropy, with the city, with our funding partners to look at that.
Right.
And
And-
the slide, the opening slide that they had, at least
Yep.
over the past 3 years, the trend is going up, but
Yep.
most certainly on the city side, if that number goes down, we should be talking about amending the contract. Is that needed? But I don't know if we can bring the slide up just very
Yeah,
quickly.
Yep,
but,
absolutely.
that slide tells it all, which is why,
Hold on.
I think it should be that second one.
Yep, I got it. Hold on.
Chief Daniels, while she's bringing up the slide,
There it is, right there. You can
to
see.
what you just said, if the program is actively engaging this population and actively doing the work, I see that it says we're up to 398 this year, which is a lower number than the previous year. But again, we're gonna fund this for Infinity. When are we going to say, okay, the city has invested enough for you to now then take it? And I know that with the limitation of resources in your department, Chief Daniels, you don't necessarily have a personnel person to do in-depth research or in-depth oversight. And the council needs to work on that with you.
Well, I accept some more money.
I want to be clear with that. So my question really is not, and I'm screaming because it is so loud where I am, I apologize. My question really is not, is the program worthy or is there a need? That's not my question. My questions are, we get in this cycle of funding and funding and funding and funding. Are we being fiscally responsible to the citizens if we don't have some type of strategic plan? And I'm not going to belabor the point again.
No,
Chuck,
I hear you.
I think you do a wonderful job. I really do. I'm not against your mission. I'm not against you guys as a team or individuals, but fiscally, if we have fiscal oversight and responsibility as council people, we should be asking these questions. We should not be writing blank checks. My colleagues, they fuss and fight about the Board of Ed, but they need to take that lens and look at everything we do with the same lens. if we're talking about being an equitable community. So I'm gonna go back on mute. Thank you for your time, because it is so
Thank you.
loud.
Marissa, you can take it down. Thank you. Thank you. Thank you.
Thank you. Thank you, Councilperson Ayers. I have a quick question I want to jump in with, and this is for probably for Gail or Marissa. In the model that you're talking about, where you're looking for philanthropy and you know trying to expand philanthropy, what happens when a municipality does cut back on the money? Does that affect your ability to sustain the philanthropy? What is the balance when those types of things happen?
It's actually, David, thank you for bringing up that point. A lot of private philanthropy right now is looking for that public-private partnership, right? How much is the city and the community investing in the work, as well as private philanthropy? So I can tell you specifically for this specific program, the city's investment did help us leverage significant dollars to be able to serve more children and families in the community. So there is this model that is really this public-private partnership that we're seeing across all of our programs, not just within Link.
Right. Yeah,
So-
we actually had it with our Child First program that serves the youngest population. We had 2 teams, and that was funded by DCF. And we went to private philanthropy and said, we need more. And because DCF had invested in the 2 teams, they provide us money now to add a 3rd team to expand the capacity.
But you do notice when you're talking about a service that you're providing that benefits a city population, then you notice if a municipality backs off, or in the case of what you just were talking about, if DCF cut funding, does the philanthropy then say, well, they must not be as serious about it, and then they step back? Is that a something that happens in that industry, in that sector? I don't know. I'm asking the question.
I think there are many factors, you know, looking at that holistically, right? And obviously there are a lot of factors that depend on that. So, Gail, you were just going to mention something as well, or Lamond, you were going to mention something as well.
Yeah, I was just going to say that I do think that that is a reality. They look at the investment. You know, it happened recently with the Grossman Family Foundation. When they saw us collaborating closely with the district, they're investing more money in the district, investing more money in our programs, because they see that collaboration and the investment that everybody has in helping the mental health of the children.
Thank you. I appreciate you.
But
you
ultimately,
answering.
David, I think the short answer is yes.
Okay. All right. Thank you. I appreciate that. And thank you, Councilperson Revelous, for letting me jump in there. Please, you had your hand up.
No worries, Chair. I appreciate you for letting me speak again. I'm just going to bounce off on 2 things, but just because of what was said, which makes sense, but you actually just answered a lot of it, so I kind of got my hand on some. But it was the fact of, for example, for my family, right? The Haitian Community Center was started in 1984 and ran till 2016. We are in 2023, and I can open the book to the playbook of the Haitian Community Center, and the issues are still the same, right? So it's kind of like or it got worse. So that whole, when do you see an end, or how do you see a collaboration of sorts? You just said it, which kind of why I forgot to put my hand down, because it was in my pocket, sorry. But it's just, then the second part of what Councilman Meeks said was, is there any data at all then in the district to connect children that aren't in the public school system that needs it? Is that even a thought? Because again, if the city's taking this over, our children that, especially with mental health, that aren't connected to the public school, but still hit the same relevance and the same traumas, is that a data? Is that a point? Are we touching that? There could be some that are just not even enrolled in schools at all, let alone a private sector. But then let's say, for example, a family who adopted a family from Haiti, they could be in a private sector because they were adopted by a family. So where do they get the resources, especially if they don't speak the language of the family who adopted them, you know what I mean, or around them. So it actually just brings some good points, maybe for data later, or how this may grow if you do need additional funds from us later. But how does that expand? And in particularly, a lot of the issues, again, from the 80s that started a lot of my parents' work, we're talking about right now. We just have a bigger emphasis with mental health now. You know, so how does that look like? Because again, yeah, what is the end for the city? But then again, if we're servicing them in a broader spectrum, it makes more sense for the city to use those dollars. So where does the future of that look like, if that makes sense in the of my question?
I don't have a crystal ball.
I know, right? I know, I can't say that, but it's funny because this
But
is
you
the
raise good
narrative
points,
that
though.
I
I
grew
totally hear
up
you.
in, and I'm 40 years old, and we're hearing a lot of, I mean, Haiti
You
just
told
had
your
floods.
age.
Yeah, I don't care, I'm 40. We just had floods like last week in several places no one's talking about, but that devastated the area too. You know what I mean? And this is all from the pulling of too much trees. So the land is sliding all over the place. Not a big deal. I'm just saying these are the same type of situations and problems because of an earthquake. Yesterday and 10 years ago, something will always happen. So just in the prospects of what you've been looking like at for the last 5 years, what do you think your projection is for the next 5 to 10 years? Possibly, you might not have that right now, but it just might give ideas to, you know, why the city, especially if we're funding, you know, we have 60, what was it, 67, 68 different languages and communities here. It could be a completely different community tomorrow that needs help, you know, but not leaving that the Latino community needs help right now. You know what I'm saying? So how does that look like for you guys? Is there a plan in any way, shape, or form? This is jumping on both Councilwoman Ayers and Councilman Meek's question. So I'm gonna shut up.
Well, just I want to say this is the 3rd year, not the 5th year.
Oh, sorry, third. Sorry.
That's
I'm
okay.
sorry.
That's
Sorry.
okay.
And if you don't have that answer, it's okay too. But if you do, or maybe if that's been juggled at all, would love to hear it. If you don't have that answer, that's
Yeah,
okay.
I just think that's a larger conversation from.
I get it.
Obviously, from the
Yeah, I
city
get it.
side and from all the organizations as we provide resources, services. I think
Okay.
the nonprofit sector, we're always grappling with, you know, how do we fund all different programs and services?
Right.
How do you sustain it? Where you find the money, who gets the money, all that kind of
Yeah.
Absolutely. Yeah, and the question you ask is a question we're always asking amongst ourselves. So it's a great question. And unfortunately, there is no simple answer or easy answer.
Okay. Like I said, it's 2023. I'm still looking at 1984, sorry, issues. So I'm with you. I get it. You know what I mean? So I get it. I understand. Thank you.
Thank you.
Thank you, Councilwoman Revelous. Councilperson Smith, go ahead.
Yeah, just a few more thoughts. You know, it takes a village to raise kids and care for kids. And over these last few years, I've been very grateful that the city has been able to contribute to helping, you know, these kids who've been traumatized, you know, coming from other countries. So, you know, I just think what we've been doing is terrific. We don't know where we'll go. You know, this has been a really excellent conversation tonight with some really important points brought up around inclusivity. So, you know, I think, you know, Lamont, like you said, you know, look at, you know, just look at the contract, maybe make some tweaks moving forward. You know, we have the funds right now to continue, but we don't know where we'll go in the future. And, you know, but I just think this has just been a really excellent conversation. So thanks, everyone.
Thank you, Councilperson Smith. I also want to just say, I'm sorry, Councilperson Meek, please go ahead.
I'm sorry. I just wanted to just let you guys know I'm for the mission, but I'm going to abstain tonight. And I am asking council for his opinion on the legality of discluding this from the local Norwalk Public Schools budget. Just so you know. Thanks.
Thank you, Councilperson Meek. I just want to say thank you to our guests tonight. being here and presenting, and to everyone. This was really good conversation about this, and I think that there's some good takeaways. I agree that perhaps looking at the contract from perhaps an expanding idea, maybe expanding helps down the road for you with the philanthropic piece of the puzzle to get more money, if we can find ways to service more of our community with these types of wraparound services. I think, it can only benefit, and it makes us stronger. And if we can be more inclusive, that's another feather in our cap, and I think that's important as well. So I want to thank you guys for being here tonight. If there are no further questions, we will move on to the next thing. Does anyone else have any questions? All right, we will move on.
Again, I just
Thank
wanted
you
to
guys
say
very
thank you
much for
again.
being here.
Yes,
Really
thank you for the
appreciate it.
opportunity.
We will move on then to 4C, updates from the Chief of Community Services, Lamont Daniels.
Chair, through you, I don't have any major updates. So if through you, Chair, if we can move forward to get
I'm
to the,
sorry.
yes.
Before you move on. Chairman Human, because this has already been allocated, we don't have to vote on the allocation because it's already allocated. Is that my
Yeah,
understanding?
we're voting on the ability of the mayor to finish the contract, basically, and execute the contract. That's what we're voting on tonight. The money's already allocated in the budget. It's a line item in the budget.
So we're not voting on the allocation, we're voting on the mayor's execution contract.
Right, we're voting on the agreements, documents, instruments, and amendments to execute the agreement.
Okay, thank you.
You're welcome. You're welcome. And that's coming up. That's one of the action items then. I'm sorry.
That's
Chief
okay,
Daniels.
sir. Through you, I don't have any significant updates. I look forward to updating you all next month. So if it's okay with you, we can move forward to
All
address the action items.
Great, thank you. We will move to section 5, the action items. Action item number 5.1. Authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary with Mid-Fairfield Child Guidance Center Incorporated for continued in-home mental health and family support services for public school children under the Community Services Department for the period July 1st, 2023 to June 30th, 2024, in the amount of $399,996. Account number noted. Could I have a motion, please? Thank you, Councilperson Smith. And I will call for the vote. Is there any further discussion on this?
I do have one more question.
Go ahead, Councilwoman Rodriguez.
Just because child guidance is also a part of this, and you just reminded me, but did our panelists left already? The question that I have though too is this. I understand the program and why it's narrated this way because of the need, but child guidance and other programs kind of disproportionately go after particular communities. And I'm wondering if this is one of those scales of disproportionality in serving particular groups of people, because if Black and brown children get disproportionately served than our counterparts. So doesn't maybe need to be answered now, but just want to bring that up in the sense of basically just being narrated to public school. It just seems to be in attendance of that whole disproportionate look onto how we serve certain families. And I want to just bring that up. If no one's there to answer that, that's fine. But I just want to make that narrated and vocalized and typed down.
Thank you, Councilwoman. Marissa, I see that you're still on the call, or yeah, are you still there? Is that something you could address?
I mean, I think it's part of a much larger conversation, Diana, and would love to, further that conversation. So absolutely would love to talk about that.
Thank you.
Okay, great. Thank you so much. Sorry.
Seeing no further discussion, I will call the vote. All in favor of this item, please signify by raising your hand. That's 3 ayes, all opposed. That's 1 opposed. Ms. Ayers, as abstentions? Mr. Meek abstains. That is 3 yeas, 1 nay, and an abstention. The motion passes. It will move to the council for a full vote in the common council. Thank you. Next, we have action item 2. Authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary with Human Services Council for 1, Children's Connection, $16,310, and 2, Dr. Robert E. Appleby School-Based Health Centers, $23,690 under the Community Services Department in the total amount of $40,000. Account number noted. Ms. Chief Daniels, are you speaking to this?
Yes, thank you. So I don't know if any of the council served on the DET. However, this program was inherited under my direction. As I pointed out in the attachment for you, the BET used to have a program called the Grants to Outside Agencies, and it was ministered to the finance department and the BET, and there was an ad hoc committee chaired by the BET chairperson. So since my arrival, we have decided to sunset that program as was, and now July 1, the funding will be allocated to me. The reason why it is going before you, because we are now using our process to move money now that the funding will come to me. Historically, this money was allocated through the BET process and did not go before Common Council. So what I am asking today is to honor those commitments of this fiscal year. However, this will conclude the grants to outside agencies in July 1. The funding will be moved to me, which we have entitled the Community Services Impact Grant Funding. So the money is still allocated for nonprofits, but the Community Services Department will now allocate it. So we will be creating criteria and just a method of how we're going to disperse this funding specifically to nonprofits, because it was always allocated to nonprofits, but it was done through the BET process. And so the School-Based Health Center and the Community Connection program were recipients of this funding for many years, and we have delayed the official process to me. So I'm asking your approval, which is my recommendation, to support this program under the old BET process, although it's transitioned to my department. But again, as of June 30th, the program as is will no longer exist. The funding will be allocated to me. And then and on the attachments, you have the program description of the 2 programs for this funding. And $40,000 has been the request for many years for under the formal process. So I'm just asking to maintain what their request is. And they have been notified that the program is sunsetting and will no longer exist June 30th.
Thank you, Chief Daniels. Can I have someone move this item? Thank you, Councilperson Ayers. So is there any discussion? Any questions? If not, then I will call for the vote. All those in favor, please signify by raising your hand, aye. And that is 5 unanimous. Thank you. So moving on to the next item. Sorry, glasses got to go on. 5, number 3. Authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary with the Carver Inc. For enrichment summer camp programs for public school children under the Community Services Department for the period July 1st, 2023 to June 30th, 2024, in the amount of $150,000, account noted. And can I have someone move that item, please? Thank you, Councilperson Smith. And Mr. Daniels, Chief Daniels?
Yes, thank you, Chair. So this is again the former BET program. For many years, the BET through the Finance Department, through an ad hoc committee, allocated this particular funding for Carver. I do want to note that we did decrease the original request. It was originally 196 because we've made some budget cuts over this fiscal year. So it is 150, but we met with Carver and we want to at least honor the continued agreement over the past years. But they also have been informed that this program has sunset under the BET structure and method, and then that money July 1 will come to me, and my task is to figure out what to do with this money. It's definitely geared to nonprofits, but myself, Deanna, and Vivian will figure out how do we support nonprofits. But again, I'm asking Common Council to honor the formal process as we close this fiscal year, but July 1, the money will be moved to me for us to disperse it, but to honor the former process. And we spoke with both parties, and they are aware that this is the last year that they will get the funding in this way.
All right. Thank you, Chief Daniels. Is there any discussion, any questions from anyone? Seeing none, I will call for the vote. All those in favor, please signify by raising your hand. And that is 5 in favor. Motion passes unanimously. Thank you. Moving on to action item number 5, action item number 4. Authorize the mayor, Harry K. Rilling. Isn't it W. Rilling? Okay, sorry, the typo there.
It is a typo.
Authorize the mayor, Harry W. Rilling, to accept and execute any and all documents, instruments, or amendments as may be necessary with DCF grant funds estimated at $35,000 to support the Youth Services Juvenile Review Board program. No match is required. The grant is non-competitive.
We like
Can I have a
grants
motion,
like that.
Thank you, Ms. Ayers.
Great, so
And,
David is here, Youth Services
great.
Director. David, you're on mute.
Yeah, so just to give you a quick overview of this program, this was a new funding stream that was created in the last fiscal year. And in fact, we're piloting a program with an organization called Elm Village. It's their Critical Messenger program, which is a specialized mentoring program that we make referrals through our JRB program to them. We just started this in February, so it's a very new program, and this will be our second year of getting these funds and working with Elm Village and Critical Messenger. So we're hoping after this next year, we're going to have enough data to really fully sort of analyze, is this a program we want to continue, or going forward in the future, do we want to use these funds to support the JRB program in a different way? Our early, again, it's only been operating about 4 months, but our early experience is very favorable. We're getting very favorable responses from the parents of these kids who've been referred to this program. We're getting good feedback from the kids who are participating in it. Just to give you an example, one of the young ladies who was referred to the program is going to be getting a certificate in cosmetology. They try to take interest that the kids have, if it's music, if it's a sports related thing. This young lady, she was interested in cosmetology, and engaging them around that sort of vocational or other sort of interest to do general, mentoring work with them as well. So that's sort of an overview of the program. I don't know if there's questions about participants or how it operates, but we are hoping to actually get a little bit more than 35,000 this year. We won't know until they figure out their formula, but the line item that funds this grant was increased from the state. We know that as the state budget was just settled. So then DCF and this specific program has to go through their formula and determine which community is getting a certain amount. But I certainly think we'll get at least the 35K we got this past year. And we're hoping to actually get a little bit more money than that. I won't know for sure until probably September, late August or September, when they finalize the formulation for what they disperse.
Great, David, thank you. Are there any questions from the council, from the committee? Seeing no questions, I will call for the vote. All those in favor of item number 4, please signify by raising your hand. And again, 5 affirmative, motion carries unanimously. Thank you.
Thank you.
And thanks, David, for all the work that you do with the youth of our community. It's fantastic stuff. That is the end of the action items. We are now up to item 6, adjournment.
Motion to adjourn.
Motion to adjourn from Councilwoman Revelous. All in favor?
Aye.
Please raise your hand. Thank you all very much.
Thank you, everyone. Have a good night.
All right, have a good night.
Thank you.
Good night.